Good evening. Thank you for spending this evening with me. It's been a while since we have our Facebook Live, and I trust that you and your family are doing well and continue to stay safe during this COVID time. It's hard to believe, but it's been a whole year since we actually lived with this. I remember last year, around April, we started to implement the safe check-in with our clinic, and it's almost a year to this day. I think the important thing about life, including the COVID pandemic that we endure, it would be fair to say that 100% of us in the world are affected by COVID. I think the important thing is not what we went through, but also what is the life lesson that we learned. And I just want to share with you my thought about the whole process, because I think all of us experience in some way, shape, or form. But it's really important to distill and learn from it. I would like it to be a more interactive session tonight, so therefore any one of you who has any question, comments, please feel free to let us know, and our producer will alert me of these questions, and so I can address it as we go along. But I think the number one thing that we see in 2020, the number one thing, the elephant in the room, that would be fear. I think fear is the biggest problem that all of us face. And in many ways, it's not a bad thing, because a lot of us go through life, the things that drive us to do a lot of things is fear. And sometimes those fear motivated us to do the wrong thing or go down to the wrong path, because somebody kind of lead you toward that way. It just gives us a sense of clarity. For example, fear of get infected and then die from it, drive people to do certain things, or fear that certain race does spread certain kind of disease, causes all these kind of racial tension. Fear of inequality in the country and around the world causes a lot of these kind of heartache. But something, all of this, I think, remind us that the most important things that affect all of us is what happened locally. Because so many times you hear that, oh well, certain events happen in Georgia and Alabama and Washington or whatever. Well, does it happen here? And I think it's really important as you go through your life, it's important to see what's happened locally, because that's what matters. For example, the fear of COVID vaccine, does it affect anybody? Does it cause any issues and problem? Are we all growing the 5G antennas? Well, again, pay attention locally. And then ask your friends and family and neighbors and other people that you know to see if there's any issues and problem. And that would be also the effects of coronavirus. So in a few months back, when there were a lot of coronavirus issues going on, you hear, you feel it. Many of us even know people or know people of people who are actually greatly affected or even die from coronavirus. So I think the important thing is to pay attention locally, because I think the information is a lot more accurate than just these kind of sensationalism, whether it is in the media or social media or mainstream media. Because at the end of the day, all of these companies and outlets are out there to do one thing. They want to sell more advertisement and ads and that kind of thing to drive up their revenue. So I think it's important to understand that and then live your life and be able to have a sense of clarity. But then the second question is, well, what do we do to be able to manage our fear? It's not the fear itself that causes the problem. I think it's the things that happen after that. And one of the posting I did before is don't drink the poison. For example, if right now I come and say, well, here you go, a cup of poison, drink it. Most of us say, no way, it's crazy. I would not drink it right now. And yet a lot of time, I think a lot of us are doing that. So out of fear, we drink even more poison. So people show up in your front door and tell you certain kind of fearful facts, are true or not, and then you ingest it. And I think that becomes a problem. So I think the important thing is, again, to be cognizant about that. But the silver lining in all of this is resilience. We, the human race, local people here in the Monterey Salinas area, and also around in the country, we are very resilient. We can endure so much. before 2020, if I tell you that you're going to be home doing your full-time job, raise a child, be a tutor, clean the house, and many other things, be the infectious control disease specialist in chief at home, you would think I'd be crazy to tell you do all of that. And yet many of you are doing just that or done just that last year. So I think it's really amazing to show that human beings have a lot of capacity to deal with life adversity. We might not tap into those potential, but I think it's really important to realize that you can. And this is the very cool reminder for a lot of us many years later, 10, 20, 30, 40 years later. Well, back in the time, 2020, 2021, we actually were able to do all of that and more. And so that gives you a better framework and remind you that there's so much that can be done. The big question is, where do we go from here? And I think it's important is to distill all the lessons learned so that we can better ourselves. It's not about what happened to us last year. It's about what do we learn from it? How do we improve from it? And I think one of the important thing is we need to manage whatever the fear factor is, whatever the stress factor is, so that we can live our life to the fullest extent. So what is it that you need? What you need is inner peace. You know, you hear about the concept about blissfulness. That's what you need to have. You need to have that sense of blissfulness or the inner peace. And to start with that, I think you need to have a sense of passion about your life. Because if your life is not going well and you constantly stress out and you don't have any real sense of passion, wanted to live your life, well, it's kind of hard to motivate you. So first you need to look at life in a slightly different perspective. But I think having a passion to live is important, because that will be the motivation factor for you to better yourself and to get the better part of yourself. We are born and have certain kind of life circumstances. We might be this bad or this good. What you wanted to do is to get the best version of yourself so that you can live your life to the fullest extent. So then the second part is that you want to be optimistic. It's all about the glass is half empty or half full. So for example, recently last weekend, we have a patient on labor and delivery that literally almost died because she got complications and things like that. And of course, I got called in and I helped to take care of her. Well, it doesn't help when, someone keep asking, well, she's going to die, she's going to die. Well, of course, that is a concern. Of course, that's why we are there. That's why the team are there, in order to help to take care of this lady. But at the same time, you don't want to just keep putting all these negative thoughts in your mind of why she's going to die. So what you do is that you want to be sure that she do the best she can. And you want to be sure that she's going to, pull through this together with you. And this is actually a true fact. I literally get right next to this lady in the ICU bed when she's all intubated. I literally whisper in her ear and say, well, guess what? We have a little issues and problem here, but guess what? I want you to listen to me and work with me so that we can pull through this. You gotta shape up and pull yourself together and work with me on this. And of course, with all the medical advancement and medication and surgery and everything else to get her to a better place. But the important thing is we need to think positive, because when we think positive, then a lot of other things is going to fall away as well. And I think that's really important. And the third one is that you want to be sure they have sense of clarity in your life, because in this lack of sense of clarity, you get lost. And when you get lost in the forest, then all of a sudden you do things that are not very productive. And I think that's really the important lesson there. And the fourth thing is that you want to be tenacious. We talk about the concept about having resilience. Well, what is resilience? It is tenacity, right? So you might fall down, you might make mistake, you might have this and that problem, but you always get up. It's not about the mistake that we make. It's not about the things that we do wrong. It's about what to do about it. And with coronavirus, it's no difference. We keep getting up, getting better. We might learn one thing or two things or three things about it, but the important thing is get up, learn from it, and do it better. And then all of a sudden, every single time, it becomes a very important life lesson to get you better. And I think that's really the important thing. then the question, well, how do I get to that point? Now, I have to say I'm very lucky that I'm kind of born like this. I'm kind of bubbly. I'm optimistic. I look at life with full of possibility. I look at mistake as, well, it is a mistake. We're going to learn from it. And sometimes it's costly. And I look, well, it's a costly mistake. And it's a big life lesson. How do you get to that point or try to get yourself to that point? It's about your sympathetic system. I think a lot of us are constantly firing off on the fight or flight response all the time. Your sympathetic system is constantly firing. And when it's firing all the time, you always tense up. You never relax. You don't have the calm moment in your mind. So how are you going to be able to think clearly and be calm and be rational sometime and have that sense of clarity that we talked about, or have the sense of inner peace? So I think the important thing is, if you find yourself constantly tense up because of anxiety, depression, or other issues and problem, what I'd like you to do is, let's do some simple exercise. And the trick for anything that we do in life, and I told a lot of my patients this, is that you want to have something simple to do, but the trick is you need to do them every single day. Because when you do that simple trick every single day, then you become better at it, and then all of a sudden you're going to be able to achieve bigger and better things. So the simple trick of why or what we need to do is you want to kind of activate your parasympathetic system. The system actually help you to calm down a little bit, have a little sense of clarity in your mind. So first thing first, you look at how we breathe. How do you think we breathe most of the time? You pay attention to how you breathe, and you will realize that what do? You breathe shallowly, you breathe fast, and you breathe through your mouth. And that becomes a problem. You look at all the animal kingdom, most of these animals, they usually breathe through their nose. They don't breathe through their mouths. And the nose has a good function to it. The position of the nose is there so you can get air in and out more efficient. You have the hairs and everything, the system, and the sinuses, so you can be a big filter to filter out a lot of particles and microbes and that kind of thing. And yet a lot of us breathe right through our mouth, which has minimal or no filtering mechanism. So that becomes a problem. Even you look at your dog, most of the time the dogs actually breathe through his mouth. The only time the dogs breathe through this nose, but the few times that the dogs breathe through the mouth is when they run around, they run out of breath or something like that. So anyway, so let's just remind yourself to do simple breathing exercise. So when you drive to work and you walk and do your little walking break or something like that, then just sort of do a simple breathing, and just so that you remind yourself to do a deep breathing, just like one of the posting I did with during coronavirus. Put one hand on your heart, one hand on your abdomen, and then suck the air in, except through your nose, all the way in, and then blow it out through your nose. And just do it slowly. What that helps is that it helps to bring all the air in, bring the air out. But you do it slowly because that's just the way your anatomy is. So it actually, literally, by itself, is going to slow down your breathing activity. When that happens, all of a sudden, you're not breathing shallowly anymore. You're not breathing super fast anymore. You're literally slowing down your breath. That by itself, after 5 or 10 minutes, you literally kick in your parasympathetic system to calm yourself down. I think that's really important. Just kind of a minor bonus. Those of you who actually have sinus issues and problem, or people that actually have a little bit elevated blood pressure, and you just wanted to do something really simple to control your blood pressure without having to take all these extra medication, then while you doing your breathing exercise, especially while you actually was driving around in your car by yourself, that kind of thing, do the same thing but add one little thing. So you do in and then blow it out, but instead of just blow it out through your nose, make a little simple humming noise, and like that. And when you do that, you feel a little vibration in your neck or in the back of your sinuses. And the amazing part is that that will help to secrete extra nitrous oxide. What is nitrous oxide? It's the substance, the gaseous substance that actually helps relaxes your sinus, your bronchial, and your blood vessel. So now all of a sudden, after about 5-10 minutes or so, doing that, you breathe better and your blood pressure actually drops. Now you don't have to believe me in this. Tonight, for example, you can give it a try. Do your regular blood pressure check. Do that, the breathing with the make a humming noise for 5 minutes. Recheck your blood pressure right after that. almost certain it's going to go down. Now, if you start with higher blood pressure, it will go down more, obviously. But if you already have a normal low blood pressure, you might not see a significant change, but that's the whole point. The point is that you want to be sure that you're kicking your parasympathetic system. Now, I don't know if a lot of you might, read or watch some of these guru about meditation. One of these specialists called, Dr. Deepak Chopra wrote a lot of books about, meditation, don't judge people, and, how mindful and all that stuff. And the funny thing is, the first thing that usually come out of his mouth is, well, just meditate. Just paraphrase what he has to say. Well, anyway, the problem is, I think a lot of us are not at that level to meditate. So I think the things to do is, what do you do to kind of do the simple meditation without doing, the actual act itself, because it's kind of difficult to do sometime before you get to that level. And the answer is simple. You do that breathing exercise, and then you take a walk in a quiet time. Quiet time, no earphone, no earbud, no nothing. And just listen to nature. So then that way, then you'll be able to be in touch with your inner self, and you clear your mind out. And I think that's really important. And the third concept I want to talk about is grounding. We deal with electricity all the time. There are all these plug in the walls and everything. And guess what you have? You have the third prong, right? That's a grounding. You don't want to get hit by lightning, so grounding in your building, right? And yet we don't have a and in the operating room, we always put a grounding pad on the patient to do our electrosurgery, right? And yet we're not really grounding ourselves that much. We constantly insulate ourselves. We put our clothes on, we put our shoes on, put our socks on. So we're not really grounding ourselves that much. So it is good for you to have a more regular grounding session. And that's really simple. Now, we lucky, we live right here nearby to the beach. I usually recommend people just, once or twice or 3 times, go to the ocean and then walk right into the water. It does 2 important things. Of course, take up your shoes, so you're actually grounding right there. But water is a very good electric conductors. So therefore, you actually disperse your electron a lot quicker as well. So that between the two, it actually can be very rejuvenating. I don't know how many times in a day I actually prescribe my patient to do the grounding exercise at the beach, and they actually follow and they do really well with that. So I think the important thing is grounding yourself, so then that way then you actually have moment to yourself to recharge yourself. And I think those 3 simple things is going to be very easy to just get your fired up your parasympathetic system. Once you do that, you have that sense of calmness, and then you'll be able to do a lot better. And then lastly, you heard it from my other discussions before, is if your body is constantly working all the time, your brain, your heart, you just calm it down with all of those kind of technique we talk about, but your physical body also needs to get a break. So therefore, it's extremely important that I mentioned about 7 to 11, eating time or not eating time is very helpful, because once you finish eating by 7 p.m. and then you have a super light breakfast like water, black coffee or tea, or nothing actually have carbohydrate in there, or even like 1 or 2 eggs, and then don't eat a real meal until lunchtime, then all of a sudden your liver get plenty of time to cleanse itself out. It sort of have hitting a reset button every single day. It's nice, easy. Once you get into that routine, I think you're going to do really well, because you're literally giving your body, giving your organs an opportunity to nurture itself back into a healthy environment. Now, I think too much time, a lot of us, we run around in the modern life, we use up our energy, our body, our spirit so much. We don't have a lot of energy, spirit, and mindset left to deal with our life. And I think it's really important to continue to focus on nurturing ourselves back to life. And especially during COVID time, as we went through and still going through, is that we need to pace ourselves, right? How are we going to be able to kind of endure this for the long run? And the answer is, you need to make sure you pace yourself. Nurture your mind, nurture your body, nurture your soul, nurture your spirit, so then that way you will be able to get up the next day and then continue with the process. I would end a lot the conversation today with a simple example, I talked to one of my patients. So during COVID times, lady has a boyfriend. He lost his job, stay with some kid in the family, and no children. And she has like big, large area in a more rural community. And the guys collect a lot of these farm equipments, and they just park it there on her 3-acre place. So the place getting cluttered up, and she get more and more frustrated with him. He doesn't really contribute that much. And then she got really frustrated. So she first come see me and said, well, I wanted to get some antidepressant or anti-anxiety medication. And then after I talked to her, it became obvious. The elephant in the room is her relationship and the clutter stuff in her home, in her yard, that she really not accustomed to. So then besides dealing with all of that and the mindfulness and how to deal with them, how to react to stress or not react to stress, I asked her, well, she needs to reevaluate her life situation, her living situation, her relationship situations, because I think it's important that during the COVID time, it really offers a lot of us a sense of clarity of what's important in our life. We no longer need to have super expensive car to drive around, expensive houses, expensive trip, and all of that stuff. What we need is right here with us, our family interaction, but how to make the best of it. And I think it's really important for all of you to kind of reevaluate and really remind yourself to learn from this very tragic and difficult time that all of us went through. But once you distill the positivity from it, once you distill the silver lining from it, then all of a sudden like, wow, this is actually pretty cool. I learned how to be resilient. I have a sense of clarity, what's important in my life. I know what to do to calm myself down. I'm going to practice some more. And now I'm going to even focus on having a healthier me. Wouldn't that be amazing? And then once you have all of that, even if down the line you're not doing all of this as much, the beauty is that you know what to do when difficult time comes. So for example, I have patients actually started the diet routine with me, and then they got COVID. Well, then the answer at that point become easy. It's not going to be the first time they hear me talking about, well, make sure you drink water, black coffee and tea, 7 p.m. to 11 a.m., no food, eat the green stuff, eat the protein stuff, because they heard it before many times. They've done that before many times. So therefore, it's very simple and easy to implement for them. So then all of a sudden, getting the upper hand for coronavirus become a little bit simpler for them. So of course, number one is that they maximize their immune system so that they can be stronger to deal with the virus. And then number two, they have a super strict diet, so then they minimize the amount of carbohydrate around. So therefore, they keep the virus at the weakest level because they're not fed by carbohydrate. So then all of a sudden, they do way better in terms of the side effects, the symptom, and clear the virus out of the system a lot sooner. And it's absolutely amazing and transformative to see that. And I want those patients to take those life lessons to the next level in other situations, other life stresses, other infective process, other kind of family situation. Because once you have the sense of clarity, you do better. And once you have learned the technique not to react to stress happens to all of us. But when you learn the technique to how not to react to stress, then all of a sudden, stress no longer consumes you all the time. I think that's really important. Whatever it is, it's important to have that sense of clarity and that tenacity that we talk about. And most importantly, just remember to look at the glass half full and don't look at it as half empty. And if you ever catch yourself looking at the glass half empty, do me a big favor. Just take a step backward, remind yourself, hey, I'm not going to say that, oh, this person is terrible. I'm going to say that, guess what? This person may be having a difficult time at home or something like that. So that basically gives a sense of compassion to other people so that you don't harbor so much hatred and resentment to others. I think that's really, really important to do. Anyway, so the next part is if anyone have any questions, comment, I certainly wanted to discuss some of that because I think that would be helpful. First, I guess recommendation and the importance of the vaccine. So again, we talk about local, right? So early on in the vaccine situation, patients ask me this all the time, well, should I get the vaccine? Is it going to be a problem? I said, Well, sure, you can listen to all these social medias or regular media about whatever the situation is, but nothing but local. So just put your ear on the ground, ask friends and family, people that get vaccine already, any major negative effects that happen to them. And the answer is minimal or nothing, nothing like major. So that's a good thing, because what matters is here locally. So is vaccine important? Yeah, of course it's important. It basically helps you to sort of like I said, the analogy is like training your soldier. Your immune system is like a whole bunch of soldiers, and you want to train them. So you train them first go around, they kind of do a little kind of exercise, and then the second time it's sort of like a live, weapon kind of exercise. But the point is that you wanted to get the training, so then by the time the real infection happens, you get all of these immune system ready to go. So I think it's reasonable. Certainly, I was one of the first few groups that actually got it at Salinas Valley Memorial Hospital. It's required by all of us that work there, and we do them, and we went through, and we did well, along with many other folks that work side by side with me. So I think that's is important. So the second question is, how do you minimize some of these side effects, right? Well, guess what? You don't want it to put more gasoline onto the fire. So even though you have a exercise battle, you might still have a little fire here and there. So the way to do that is really simple. Water, black coffee, and tea. Did we hear that before? 7 p.m. to 11 a.m. No food. Just water, black coffee, and tea. And then just eat the green vegetable and the protein stuff. So therefore, you're not having too much excessive amount of carbohydrate floating around, because more carbohydrate is the same thing as more gasoline into the fire. It makes it burn stronger, more side effect. Now, if you're already super healthy and you have no other underlying conditions, that kind of thing, you don't really have to be that strict. But the point is that, you just go easy on the carb intake during the first 48 hours or so. And I think just doing that, you're going to do really well. Number 2, can you catch the virus if you already have it? Yeah, absolutely. So you hear about the vaccine. Just because you have the vaccine does not mean that you can just take off your mask and you talk to people and act like normally. Why? Because, well, how do you know there is no other unusual strain of vaccine that come from South Africa, from Brazil, from Silicon Valley, from the East Coast, and from Europe? So right now there is so much unknown, and the adage we had back early on in the the COVID pandemic is still the same. You can never be too careful. So what I'd like you to do is still practice, all of the social distance and mask and hand washing and all of that important precautions, because it doesn't hurt anybody. You won't spread any disease to anybody, and then it keep you and your community a lot safer. How do you set boundary for COVID safety when meeting with people outside of your household? How do I communicate what I'm not comfortable with? Well, I have to tell you a real situation. So the other day we have one of the doctors come over to give us a little award thing. And the funny thing, he came into my clinic here, took off his mask. Oh, I'm fully vaccinated. He was going to give me the little certificate and take a picture. And guess what? It was a little awkward moment, but I held my ground. I kept my mask on. I keep talking. I said, "Wow, you can never be too safe. Continue to be cautious." And guess what? He respected that. Put his mask on, continue conversation, do that picture, and that's that. And I think it also delivered the message as well, is that, look, we, healthcare provider, keep our mask on, so when we get the picture, we have the mask on as well. So I think it's actually totally reasonable during this day and age to say, hey, whatever that you need to do. So yeah, I want to keep my mask on, I want to keep the little distance, that kind of thing. It's absolutely reasonable. Whatever you do, I think the important thing is realize that you do what's best for you and your family, and do not let society dictate what you should do or shouldn't do. I think that's really the important thing, because the best doctor in the house is you yourself. Wouldn't that be sad if you give in to the society pressure and then take your mask off and intermingle with people and then you get sick? Might not be life-threatening, but you'll be kicking yourself. So therefore, I think it's really important to listen to your inner self. especially a lot of ladies that I interact with, has amazing sixth sense. So if you know that you're one of those people, then make sure you do. Is it safe to be in the car with another person outside of your household? Yeah, so when you're in a car, treat it like you go to a restaurant or a hair salon or exercise place. Now a lot of the exercise place kind of open up, as you know. So you go, do it safely. Put your mask on. When you get off, wipe your hand, keep it clean before you put anything in your mouth if you start eating or drinking something. So you certainly can, but keep that little distance. I think that's helpful. The risk obviously is less now compared to before because the overall prevalence of the disease is less, but it's still out there. And we don't know what are the new strains are coming, so therefore it's really important to continue to be safe. And just a side story, I have one of our nurse in labor and delivery, and remember way at the beginning of 2020, and the requirement is that if you don't want to get a flu shot, you have to wear the mask. And she was the only one to wear the mask at that point. Everyone else don't have anything because it wasn't COVID yet. And it was funny because down the line, well, guess what? She's like way ahead of the game. She already have that protection. And I think the cool thing is that sometimes you feel that you're the only one that does it, but trust yourself and have the level of comfort knowing that you've done what's right for you, yourself, and your family. And at the end of the day, that's what all matters. The other items I think is really important to remind yourself and your family is that, plan it out. Plan your life out. Don't let surprises happen. And if you happen to be in a weird situation that you don't feel comfortable, it's totally okay to disengage. Nothing wrong with that. So don't feel like you have to be in certain kind of enclosed environment. So if you're in a closed environment and didn't feel well, then just back away. Keep the little extra distance. Goes a long way. Do masks work, and which work best? I think the important thing is the filtration. I usually wear just a standard surgical mask, which is readily available right now. Sometimes people double up, which is reasonable. The cloth mask, I think, is okay. Sometimes they have these cloth masks that you actually put in the little insert that has a filter, works even better. The only one thing that doesn't seems to work real well, but some people like them, is little kind of what do you call that? The little thing put on the neck.
The neck gaiter.
Yeah, the neck gaiter. And it's okay. It's not that bad, but the problem is it's just a thin fabric, number one. And I don't know about your experience, but every single patient of mine that wear one of those, they always fall off. So they keep going falling out, and then halfway talking to me, they pull it off. And it's just very, awkward for the patient. And it doesn't protect a lot when they just keep falling down. So I think the important thing is wear something actually hang on to your face. I don't actually recommend people wear these plastic things to put over that much, because the plastic thing actually has so many openings and holes everywhere. It actually accumulates moisture inside, makes it kind of weird and uncomfortable. But the important thing is that because of all of those dents, it's easy for anything to flow right in. So people wear the additional shield. I think it's okay, but that's in addition to your mask. So don't just have the shield and no mask. The big one that you see, the one go all the way down. Finally, what I think is, I guess the other question is, when we wear a mask outside, walk and exercise. I highly recommend no. When you by yourself, in the fresh air, especially in our area, Central Coast, where the air is very, very pure, then I think it's important for you to really, get in and out as much of the fresh air as possible. Now, you want it to have your mask in your pocket ready to go, so then that way, then whenever you see people come across, you put it on, so then that way, there's kind of common courtesy around. Now, even if you come across people that don't put it on, you still put yourself on because it's still protecting you, right? So I think it's really important. Of course, if you see someone walk down the path, if you go hiking, it's okay to kind of turn into the little sideway, look the other way or something like that. Nice common courtesy. But don't forget to say hi to people. I think sometimes because the mask is on, a lot of us kind of forego the social cue of just being, friendly. Say hi. So I think it's good to say hi, how you doing kind of thing. Doesn't mean that you have to project your your voice that direction and somehow get a droplet going their way. But the point is that saying hi, I think is good. It just keep that social connection with other human beings. Would your practice go back to in-office waiting room? I don't think so. I think the in-office waiting room is just a disaster waiting to happen. I don't know about you, but I remember a lot of the time people go and sit in the waiting room. You see a sick mom, a sick baby, a sick individual, and they cough and they sneeze and sit in the little waiting room. Doesn't matter how many times you clean it. I think it's an impossibility that you're gonna catch something. How many times people catch flu or cold and that kind of thing in a winter, right? And so I think we actually learned something. Again, the silver lining with coronavirus is that we gotta be careful about these kind of things. Airborne disease is very easy to get around. So wouldn't that be nice if they come in, they check in, sit in the car, when it's their time, come right in, bypass any waiting room, get in and get out. It just minimizes a lot of the issues and problems. And I think that makes it very safe for everybody, both for the staff as well as for the patient, and it works out great, and I think it's great. And we actually we're just kind of talking about this throughout the whole pandemic. We do have patients come in and out, and I know sometimes some providers get very, very worried about interacting with the patient in the clinic, but we do have a fair amount of that. We keep it safe, and it's actually super duper safe because of the fact that we are very careful and consistent with that, and I think it's really important to do so. How do you manage stress as we go back in person to school or job? And that's a funny thing. When people were told to be off of work and do everything from home, people say, oh my God, I got stressed out so much. And I have to agree with you. I have a number of patients today. So, oh my God, they get so scared about or worry and stress about getting back to work because it's a different kind of stress level, anxiety and all that stuff. You're getting used to your routine here. So I think the important thing is, just like anything else, is you want to manage it well. How do you do that? Consistency. So what I'd like you to do is to be prepared for these kind of change in your life, any change in your life. First, you don't want to have too much life distraction, because life distraction is what gets you in trouble. So if you know you're going to go back to the new environment, instead of doing like 3 things at the same time, why don't you just focus on that? You want to make sure you do that really good. So you're going to have a fixed schedule. You show up to work certain time, you park at certain spot, you drink your morning black coffee certain time, you turn on your computer certain time, and then that way then you do everything in the same routine. All that does is give you one important things in your life, is that you have that consistency. Things are not spinning out of control. That reduces your cortisol level, reduces your fight or flight response, so you stay a lot more calm. Even if some disaster happens, it's not going to blown out of proportion because of the fact you don't have other kind of competing distraction. I think that's really important. And then number 2 is then once you get good at that, then you can add the other items that is being at the beach with our family okay, especially when beaches are becoming busy. Yeah, I think it's great. I mean, we are very lucky that our beaches, especially our local beaches like Marina and Seaside, hardly have that many people. We'd be lucky to have 20, 30 people in a very expensive part of the beach. So therefore, it's good. You just find yourself a corner that you feel comfortable. But there's so much room. It's not like you go to the south of France or Florida where you see a whole bunch of people all close together. Or even Southern California sometime in the past. So yeah, totally reasonable to do that. Have a nice family outing together. But don't forget, take off that shoes, walk into the water, bring your short with you, grounding yourself because you're going to feel very exhilarating. Do I have any recommendations for fixing my posture? Well, it's actually not as hard as you think. Always put your shoulders straight up. Take a deep breath and do that. Now, there's a couple exercises that I actually do regularly, and it works really good, and I highly recommend you to do that as well. So if you do your walking routine or whatever you do, then you put your hand right here in the middle, and you go all the way up, straight down, and go down. So that basically forces your body to be straight up like a stick. And so you do that about 10, 20 times or so. and then you put back your hand backward and do the same thing the opposite. So once you do about 15, 20 times for each of those positions, then all of a sudden you kind of force your body to be super straight up. It actually improves your posture, but also improve your back as well. Sometimes long hard work day, you have a lot of back pain, all you want to do is just sit down and do nothing, or watch TV or something like that. Doing that simple exercise is going to stretch your back out quite a bit, and it's going to do wonder for yourself. So definitely that'd be helpful. But the important thing is remind yourself to do that. I think sometimes when we're walking around with a cell phone and everything, we keep looking down, and that actually causes a lot of the problem. And have you ever wondered sometimes, like, wow, how come I lose so much hair and have a lot of headache and that kind of thing? Well, that's why you're looking down. So guess what you do? Your muscle in your neck all of a sudden gets spasm, and you can tell very easily. You put your hand in your back of your skull right here on the muscle, and you push on it. And if it's kind of uncomfortable, or especially you feel a knot, then you know that's a problem. Well, guess what? If it's spasm, then the circulation to your scalp is going to be decreased, and when the circulation is decreased, guess what happened to your hair? Not getting enough nutrient, you start losing your hair, in addition to the stress that you have in your life. So it's really important to have a more relaxed scalp, and that will help to make perfusion better, including having adequate amount of vitamins, as well as stress management, and all of that is going to help to have a better, healthier hair and scalp and everything else. This one is not COVID related, but how would you naturally increase your metabolic rate? You don't have to. Why do you need to increase your metabolic rate? We all are born differently. So let's just compare a fat person and a skinny person. So a lot of us think that, well, a skinny person is great, right? Not so. I'll tell you why. So fat person, what happened? A fat person, assuming that their metabolic rate is a little lower, so you eat some extra, your stress hormone, all of that causes your sugar to go higher. Your body secretes some insulin to bring it lower to normal level. So what happened to that sugar? Get converted in fat. So then all of a sudden you gain weight a lot easier. The skinny people, because genetic makeup, they usually have the similar situation happen, but when their sugar go up higher, they're unable to store a lot of that in terms of fat. So then they have more sugar, carbohydrate floating around. So how do these people get rid of their extra sugar? They breathe more. Their metabolic rate is more. And actually it's studied. So therefore, what happened is that they blow off a lot of these carbohydrates through breathing and higher activities and that kind of thing. So of course you think that they are lucky, but not as lucky as you think. How many times you know skinny people that you know in your life that have all sorts of weird, anxiety, depression, a lot of pain, fibromyalgia, chronic pain, endometriosis, all that stuff. Why? Because when they have the sugar increase, and when they get to the point in their lives that they cannot, get rid of those extra carbohydrates easily, and they're unable to store them in form of fat, those circulate around. So then all of a sudden these fuel of life circle around. So whenever they have any kind of inflammation in the body, whether they have a migraine or the endometriosis, fibromyalgia, arthritis, cause big flares up. So then all of a sudden they have a lot more pain than regular people. So routinely, I have patients coming in with these kind of problems. I actually put them on more stricter diet for just a few weeks to calm things down whenever they have the flares up. And it really works wonder. In addition to, of course, make sure they have a proper detoxing techniques and healthier body and stress management, that kind of thing. From Ronnie, wanted to ask a question. Change is inevitable. How do you react to the crucial or how do you lower your cortisol level?
She's just commenting.
Oh, Ronnie just comments. I want to read it out for you because you want to share it with all of us. Change is inevitable. How you react is crucial. She would love the approach of routinely and consistently doing that, lowering the cortisol level, lower the stress, lower the unwanted way. And that is the important things in life. And I have to agree with you, Ronnie. And you do practice what you preach. I mean, Ronnie actually stay in shape for many, many years. People know Ronnie, see that she have different kind of weight level at different time. And that's really amazing to see that she's able to do that. Sometime in the morning, I become very hungry. What should I eat? can eat in the morning. Well, the question is, how come our ancestor eat 3 meals a day, and then now Dr. Khieu said we skip breakfast altogether, right? The answer is insulin, spiking the insulin. So for example, ancestors go to work 3 times, go to work in the morning, so they work in the field and that kind of thing. So they eat a breakfast, they go to work, they burn off that extra calories, so the insulin level does not spike up very high. Number 2, when they go to work, you think they get a break? No, they don't get a break. They actually work all the way into noontime or even later. So therefore, they eat 3 meals a day. They hardly have any snack. So therefore, they're not having that constant insulin spike. Now, in modern life, what do? We feed ourselves in the morning with a bagel and a latte, insulin spike. 2-3 hours later, it goes lower, and then we start to eat some snack, insulin spike. Noontime, we have a sandwich, and then insulin spike. And then afternoon, we have another latte, insulin spike. And then dinner time, we have a couple drinks, and that insulin spike. So that's the problem, is that we constantly have so much insulin spikes all the time. No wonder a lot of us become metabolically resistant, and then we gain weight and have all these kind of medical conditions associated with that. So how do we kind of adapt to this kind of modern life? Well, if we actually minimize, we give our liver a break to cleanse all of that extra sugar around out of our system, then when we start at noontime, 11 or 12 o'clock, we start with pretty empty liver, and that will take a lot longer for it to fill up. So that's really the bottom line. Just kind of adapt to the environment that we're in. Can anxiety cause acid reflux or IBS symptom? Absolutely. What do you think anxiety is caused by? You get anxious, and then your stress hormone, your cortisol level goes higher. What does that do to your sugar? Your sugar go higher. Sugar, again, being the fuel of life, that if you have a little bit acid reflux, a little bit inflammatory bowel syndrome, then all of a sudden things are rumbling more. Now, sometimes people actually got beyond that. So if you have these things for a long time, then you get beyond that. Then all of a sudden you have what they call leaky bowel syndrome. How do you know you have one of those people that have leaky bowel syndrome? Really simple. When you're younger, you get no allergy to anything. All of a sudden now you're about 30, 40, you get allergic reaction to all sorts of things. That's usually the typical leaky bowel syndrome situation. What that means is that your basement membrane on your bowel is supposed to be protecting you, but what happened is that because of the chronic inflammation or the chemical you expose yourself to, now actually broke down some of those barriers. So now instead of having a tiny amount of those substance go into your circulation, now you get a lot more. So all of a sudden your body starts to react to that. And then the first symptom usually that you see is a little kind of weird, skin kind of allergic kind of skin reaction, because your body know what to do with these toxins, so it's not going to bubble up in your skin, because your skin is the biggest organs in your body. So the things to do is pay attention to those kind of things. And yeah, so same thing. So because of that, you kind of worry. Now again, I told everybody this, and it is 100% true. The best doctor in the house is you. So if you think that it's somehow related, keep looking further. Keep paying attention to the trends, the correlation between the stress or the food you eat and the symptom that your body is telling you. Whenever you have these symptoms, most of the time, your body is telling you something. Your body is sending you a message. And I think it's really important that when you pay attention to that message, you have a sense of clarity as to what is the starting point. Now, sometimes you're not sure. It might be 1 or 2 or 3 things that might cause the problem. But the more you look into that, I think the more you realize, it must be this or it must be that. So whatever it is, I think it's really important to kind of pay attention. And then all of a sudden things actually calm down quite a bit. Talking about the chronic inflammation, I guess the next question, well, how do you know you have a hernia? Well, hernia is a lot easier to know because of the fact that what is a hernia? Hernia is your fascia in your abdominal sidewall gets spread out and they get weak. So they're actually protruding out a little bit. So if you have a bowel underneath or sometimes other kind of organs are protruding out, then you have the little kind of protrusion. A simple ultrasound would do, and if the ultrasound can't tell you, then a CT scan will tell you definitely. And that is actually a very fixable situation, so that's a little bit easier. But if you worry about it and you really don't want to have any surgery or anything done, and you don't have a lot of symptoms, how do you kind of watch it? Really simple. Just measure to see that protrusion, to see how big is it. If it's getting larger and it just stay there, doesn't go away when you push on it, and you're getting really uncomfortable, yeah, definitely you gotta look into that further. Again, listen to your body. If something that is important, it's gonna be there. It's gonna get worse. If you don't have anything important, nothing's gonna happen. You do your simple routine, all of a sudden it kind of disappear, and I think it's reasonable. Going back about the inflammations and everything, it's really important to kind of, again, pay attention to what body is telling you, have a sense of clarity, and be optimistic. Look at life as a half full and not half empty. And have a little bit of compassion to your fellow co-workers, friends, and family. Sometimes they act a certain way, but you know something? A lot of time, it's not the reflection of you. It is a reflection of what's going on with their family or what happened to them. They might have anxiety, depression, or other kind of issue. So it's really important. Don't take it personally as if it is an attack on you. It's usually reflecting of what happened to them. So have a compassion. Realize that they're going through a difficult time. I really appreciate your time spending with me tonight. I think it's invigorating. We actually make the best that we can in a terrible pandemic that we're in. I feel very fortunate to be a part of many of your lives, and continue to work together for a betterment of our local society. And we can continue to join in the Facebook group conversation as well as you see necessary. Again, if you ever have any other topics or any other discussion you want me to include in the future, feel free to send it over, and then we'll be able to incorporate that to future talks. I would like to close by thanking my producing team, Grace and Diane. They always done an excellent job making sure that this is running without a glitch. And I just have to show up and talk to you as if I'm sitting in a room talking to a group of individuals or a patient that I do every single day. So it's kind of nice. It's natural, come from the heart, no script or anything like that. And have a good night. Thank you.